Greetings and good evening, morning, whenever you happen to be watching this. This is Dr. Wood, and today I want to do a video talking about some of the research articles you're probably going to be looking at, kind of going through the bones of the article, what are the different key components, and kind of what you should be looking for. Some things that every article should have, maybe only some articles will have, kind of get into those, and I kind of want you to start thinking about these things as you're going through and reviewing these for your paper. I want you to think about these when you're doing your literature review submission they're going to be putting up this week. So without further ado, some of this will look pretty similar to EpiBio if you have not repressed those memories completely, but some of these are very similar slides here. But anyway, how should most articles be structured? And I have one ready to go that I'll show you as an example here, but basically, we have several key components here that you're going to be seeing in most articles that you're going to run into. Starting off with the abstract or the summary. This is basically just that overview or summary of the work, right? It's going to give you sort of the highlights of what the purpose of the article is, what the methodology was, what the results were, and then finally their conclusions. Keep in mind, it is not uncommon for abstracts, while they may look good and they look like kind of the cliff notes of a research article, they can have some inconsistencies with what the actual results are in the full article. They may downplay some things, they may overstate some things. So while it is important to include those, because that's how you sort of capture your reader into kind of diving deeper, this is sort of like the advertisement for an article. It's important to not just stop with the abstract, right? So you got to dig a little bit deeper. So that's when you get into the actual article itself, which is going to be these components here, right? You're going to have your introduction, your methods, your results, discussions / conclusions, and then finally your references, right? You've already developed a pretty good reference list so far, but we'll talk about that briefly here. So let's get into the details into our different components of the article. So as I mentioned, the summary of the abstract, it should be pretty concise, right? Just a few paragraphs long. And if you ever decide to publish your work, you may look at some of the requirements for an abstract, and you'll find very, very short, maybe only a few hundred words, a few paragraphs at most. Because again, you don't want it to be too laborious. You really want to have that kind of bite size, sort of like, hey, come read this. This looks really interesting, right? And again, you're going to find that there can be inconsistencies. It's not always the case that the reviewers are going to be able to catch inconsistencies, and so it's very important to be aware of that. And again, you'll find the different abstracts, depending on the journal that you're looking at, will be very different from one to another, because it has to do with how the journals themselves want them to be structured. So nothing abnormal about that. Into the introduction of the article itself, you're going to find that typically it'll be including a very brief amount of background information on the topic, basically what the authors need the readers to know in order to kind of hit the ground running. We get into your methodology and the rationale for the study, etc. Again, should not be super laborious. You also want to include that rationale, as I mentioned. Why is this important? Why do we even want to do this work in the first place? And then you'll maybe do a brief review of some of the literature, maybe some of the more kind of like landmark studies in the field, just to kind of make sure that everyone's on the same page as you dive into the article itself. Now, for your case, when you actually go through these introductions, you're going to find that for your paper itself, you're going to be more focusing on the background information on the topic and the rationale. This will mainly be your introduction, and then when you actually dive deeper into it, the body of your article is going to mainly be that literature review. Okay, so this is going to be a much larger topic for you, because you're going to be looking over many different pieces of literature, kind of pulling it together to make your case for yourself, whatever conclusion you come to. Now, I have one pulled up here. Let's go ahead and take a look at this article here. Here's an article talking about pre-packed naloxone administration for suspected opioid overdose. And so just off the bat, and again, I focus on tox stuff because that's what I'm most interested in. So if you're not interested in this, sorry, but this is just kind of what I know. Anyway, again, this is basically it's a pretty recent article that was published. You can see here May 16th, 2019, so very, very recent. And basically it's just saying, right, like the title says, they're looking at using pre-packed naloxone for treating a suspected opioid overdoses. Also important here, a retrospective study of the regional poison center data. So I already know a lot about this study even before reading anything about it. They'll list their authors, kind of list when it was being published, etc. And then, of course, their abstract. Now, again, looking at this, it's fairly brief, right? So just a few paragraphs long. They really just hit the nitty-gritty, and then you move on. Again, this is just designed to kind of tantalize the readers into digging a little bit deeper, okay? Now the background, this is part of the introduction here. So they'll cover their background in terms of why they think this is important. They're talking about opioid overdoses, how it's such an epidemic and how it's killing so many people. And this is why this is really important, right? Then you kind of go into talking about the adulteration of heroin with fentanyl-like derivatives. And again, this is why, this is important because this is a new issue that we haven't seen, but maybe for the past few years or so. And then going into talking about the actual administration of naloxone and whether or not this is important. Again, this is where they do kind of a brief review of some of the literature. They'll talk about, say recent studies of intranasal naloxone, blah, blah, blah. Again, this is mainly just to get everyone up to speed. So that way when you actually get into the methods and the results and all of that, everyone's kind of on the same page there. Okay. So moving on to the next piece here. Next to the methodology, and this is a very, very important section. It is very frequently skipped because it is very boring. We get this, right? We understand it's boring, but you need to have it in there, and you need to be able to discern these things because this is how you're going to determine whether this is a good study or not for you, whether you feel like this applies to your patients that you treat, or whatever the case may be. But again, it should be talking about things like patient populations, should be talking about study designs, data collection techniques, and any of the analytical and evaluative procedures being used. Again, most people skip this stuff, but I think it's important to at least try to go through it, make sure it seems reasonable in terms of how their study design was chosen. Because you may read an article, get to the methods, and be like, well, it sounds kind of bogus. Like they have really shoddy sort of study designs. They didn't really control for things appropriately. Maybe this isn't an article I really need to dig that much deeper into. So in this case here, getting into the methods, most of the time when you're looking at one of these, they get right off to the bat saying, okay, we conducted a retrospective study of the records of suspected opioid overdose victims who received naloxone from a pre-packaged naloxone kit. Notice here, oftentimes these sort of studies will also say where they got their data from, which is important. So for instance, here they're looking at the Maryland Department of Health Overdose Response Program. Now, this is important because, one, this tells you geographically where the study was actually done at. And now you can start to take away, like, well, is this applicable to my patients? You have to decide, well, are people with suspected opioid overdose in Maryland similar to the ones I'm taking care of in Orlando? Probably. If this study was done in France, could you make the same assumption? Maybe. If it was done in Thailand, who's to say, right? So you have to sort of make those sort of evaluations to say, well, how similar are these patients here? Are they going to react differently to opioid overdoses? Is naloxone going to work differently? These are sorts of questions in your mind based off the type of patients that they're going to be including here. Okay. So anyway, so they go through their topic and they talk about how they're going to be administering this naloxone, who's going to be getting it, etc. And again, just going through the details. I'm not going to bore you with all this sort of stuff, but just to let you know that these are the things you should be focusing on. Again, as I said, they're boring. Even I'm skipping over it in this review for you guys. But again, really just to try to demonstrate that, you have to review this stuff. Otherwise, you're not going to know whether this is a reasonable article or not to apply to your patients. But let's say for the sake of arguments that yes, it is appropriate. The next part I really want to focus on here, and this could be possibly even more boring, if it is possible, is the data analysis, right? So you're actually going to be looking through to see how do they actually go through and provide their analyses. What kind of statistics were they running on themselves? So as an example here, they're talking about sort of the data they were collecting. They talk about the descriptive analysis, right? So again, this is just describing what they actually found, not actually making any inferences. So if you go back to a few videos ago, we talked about the difference between descriptive and inferential statistics there. And again, they're determining characteristic studies. They're looking at frequencies. They're looking at means of dichotomous and continuous variables. We've covered this before, so you know all what those mean. They looked at mean and median doses. They're looking at things like the dose of the fixed doses of the pre-packaged naloxone kits as a categorical variable. We know what that means. Chi-square tests were being used for looking for associations, So again, these are the things you want to kind of key in on to say, okay, well, what am I even going to be looking for in the results to see again, is this anything that's going to be useful to my patients here? Okay. For these retrospective studies, it's also good to look at things like, the time frame you're actually going to be looking at, etc. Okay. Another thing you'll find in a lot of papers as well is we'll talk about the institutional review boards who approved the study. Again, it's not usually something you want to concern yourselves about. If it's published in a pretty reputable journal, then it should probably be assumed that it got through the IRB. Okay. All right, so next up we have our results of the article. Again, this is where we're going to find many of the tables, the charts, graphs, and figures and whatnot that the authors have compiled based off the data that they found there. This is where a lot of the analysis comes in and the interpretation of the data, right? So they perform the statistical test, they find out all their p-values and their confidence intervals and all of those things. And again, one of your jobs as a clinician is to be able to evaluate those to make sure that the things that they're coming up with, you can kind of interpret that, right? Because when you take these results and apply them to the discussion, you want to make sure that you're reaching the same conclusions that the authors do, because sometimes you may find that, they'll report out something as being significant, but maybe it isn't, or maybe they try to overstate maybe the clinical significance just because something is statistically significant. That's a common thing you may find. And so that's why being able to do your own analysis of the data is so important, to be able to understand what does that confidence interval mean, what does the p-value mean, etc. Right? So again, you're going to be an informed clinician because you're already going to be able to sort of have a more trained eye when you're looking at this sort of thing. So getting back to our article, we can see that the results here oftentimes are going to say information about what they found in terms of demographics. This is where you get a lot of the descriptive sort of statistics. Oftentimes you're going to find that they will have information about how they actually broke down groups, how they got divvied up into different categories there and whatnot. Again, I'm not going to bore you by going through every single detail here, but you kind of get the point, right? So again, they'll typically go through the descriptive statistics, and they'll actually get into what their actual conclusions are in terms of what they found, how, in this case, how patients improved, things like that. And again, these sorts of tables and graphs and whatnot are nice because they can kind of help you to visually identify how things went in the study in terms of, how patients were managed and how they, what kind of outcomes they had, things like that. So again, results are very important to be able to evaluate it and say, okay, well, what are we actually finding here? Again, here's some nice graphs kind of showing you differences in things like naloxone dose versus reversal rates and things like that. Okay, so that's kind of what the results section should be doing for you. And next, you're going to have your discussion or the comments. Usually this is termed as discussion. Again, this is where the authors are saying, okay, we took all this objective data. Now, what do we actually think this means, right? So this is where they actually go into the nitty gritty of saying, okay, well, this is the statistically significant result, or maybe not significant result that we found. And what does this mean in terms of our conclusions here, right? Sometimes you may find that they'll incorporate other studies to kind of compare and contrast. They'll say, like, well, we did this study in Maryland and we found these results. Here's one that was done in California, to see how they compare, right? That's one thing that you can do to try to maybe increase some of the external validity of your study, which we'll talk about in a few minutes here. Things like that. Again, they may present things like oversights and mistakes that happened during the study. If they had a lot of people who maybe were lost to follow-up and things like that, they can talk about those sorts of things there. And they really should be talking about the strengths and the weaknesses of their article, right? They should be talking about, they say, well, this is the first type of study that's ever been done on this subject. Or they could say that, this was a really good randomized double-blind controlled trial. Things that strengthen their conclusions, to say, like, this is what we think actually is true, versus they may also list out some of their weaknesses, saying, like, well, it's a really small sample size, or maybe this is only a very limited subset of patients, or maybe the outcomes they were looking at were being reported by objective sort of measures, things like that. This is typically the most speculative sort of section here, where again the author sort of applying their own interpretations of the data. So again, you want to make sure that what you read in the results section sort of comports with what they're finding in the discussion, right? If the two don't match up, then something's going on there. Maybe the authors are coming to a different conclusion than what you are, right? Just because it's in a journal doesn't mean it's the gospel truth. It's just a piece of data like anything else. And again, it is subject to interpretation. So getting into the discussion section here, we can find that, again, they talk about the subject really briefly, talking about, hey, here's how some of the similar programs have been implemented and some of the results that they found there. They talk about some of the interesting things they found in their studies. So in this case here, they found inverse trends between the dose of naloxone received and the actual clinical reversal that they found. Again, this is very speculative. They say, well, here's what we found. This is really interesting. We think that maybe this is happening. And some of that can be supported by other pieces of literature, right? So it's always important to try to cite anything that you're trying to tout as a conclusion there if you can, right, from other sources. And again, kind of talks about limitations here. Again, if a study doesn't mention any limitations, they're probably lying, or they're maybe are not under the most rigorous scrutiny as you might expect, and good, reputable peer-reviewed journals, things like that. Again, here they say, okay, we have several limitations. It was a retrospective study of poison-centered data. Obviously doing prospective studies would be much better, but maybe it's really hard to do that. Maybe it's expensive or not ethically feasible. Voluntary reporting is a common problem when you're looking at retrospective data. Reporting biases, law enforcement officers were the main people who are administering this stuff. So again, you can go on and on and on about the different limitations here, but the authors will tend to focus on the kind of the key things that they thought could be influencing their results in terms of what has kind of the biggest effects there. Okay. And then finally, they should have some sort of conclusion, usually a brief comment or two, so kind of summing up, their final conclusions. Usually just a paragraph long. Not every article is going to have this, but it is a good sort of bow to tie up and wrap around your package there. Sometimes you have acknowledgments if there's any people that particularly contributed to the article, things like that. And then we'll talk about disclosure statements in just a few minutes here. And the final thing they'll mention is going to be the other reference list. Now, as you've probably seen in doing your own research, you're going to find that having the reference list is good because, one, you can see how well read the authors are in terms of getting the most up-to-date literature on a particular subject based on when it was actually published. But the other thing is it also can give you some direct links to other primary research. And some of you probably found when you were going through your articles trying to come up with a reference list that there was a rabbit hole that you fell down where one article led to another article that led to another article and so on and so forth. That sort of rabbit hole is very easy to find yourself in when you start going through the reference list on a particular paper. So, again, as I mentioned, whenever approaching an article, it's really important, I feel like, to concentrate on the method section. Again, it's hard because it is the most dense, sort of dry information that's there. But again, don't just focus on the abstract. Don't just say, well, let me draw this conclusion from an abstract, because you can get yourself into trouble that way. Look at the methods, make sure that it actually makes sense, make sure that it actually has any sort of applicability to your patients, things like that. You may start to look at the methods and be like, well, this isn't a very good study design, or it actually doesn't have anything to do with my patients that I may be taking care of, etc. And so from there, then you can start to read into, actual data collection they did, look at the results, look at the conclusions, etc. Now, one thing I want to note here as well is this topic of external versus internal validity. Now, what does that actually mean? Basically what this means is that internal validity is how much sense does an article make within its own sort of microcosm of an environment, right? So, for instance, if they say that we randomize patients to treatment versus placebo, but then they found that there was, say 90% women got put into the treatment group and 90% men got put into the placebo group. That doesn't make a whole lot of internal sense because you just said you randomized it, so how would it be that you had such a skew of gender? That means it doesn't have much internal validity, right? Or, for instance, if they try to do, say, non-parametric tests, they try to do parametric tests on, say, non-parametric data, that would be, violating those assumptions we talked about whenever you use parametric tests. That doesn't make internal sense, and so that would have low internal validity. Okay, so articles should have at a baseline pretty decent internal validity, and I think that a lot of times when you submit to a peer-reviewed journal, that they will look at that and they'll make sure that hopefully you do have some internal validity, right? So how much sense it actually makes in terms of just the article and its own little microcosm. Now, external validity is probably more important when say let's take for granted that the article you're looking at has good internal validity. It got published in New England Journal of Medicine. It probably is going to have some internal validity there. External validity is that next step where you're actually going to say, like, well, how does this apply to my patient? So in the example we were looking at, dealing with opioid overdoses and giving them naloxone in Maryland. Now, taking that information, applying it to my patients in Orlando, does that make sense? Do patients in Maryland have similarities that would say that data should be valid if I were to apply that to my patients here in Orlando? That is external validity. If I say yes, that I do think that it's applicable, then yeah, that works, right? Let's say they went through the demographics and they had almost no Hispanic patients. Well, here in Orlando, you're going to have a lot of Hispanic patients, so maybe there's some degree of discrepancies there that may make that information from the article not very applicable to your patients. That would have low external validity. So again, this is why it's really tough in pediatrics, because a lot of articles you find are going to be mainly focused on adults. And again, randomized controlled trials in pediatrics is difficult to do. So sometimes, we'll extrapolate a lot of data from adults back to pediatrics, and that may hurt the external validity of those articles because it's not done in pediatrics, right? So again, take things with a grain of salt. Always consider, how does this apply back to my patients that I'll be treating in particular, and you'll kind of get a good feel for whether this article is really useful or not to your clinical practice. Now, one last thing to talk about here is article bias. And so again, there's different forms of bias, right? So looking at things like randomizations and blinding and things like that should take out things like measurement bias and allocation bias and things we talked about in classes previous to this. And again, this should be handled if possible through study design itself, right? And again, that's part of that internal validity that I mentioned just a slide ago. And most of the peer review process will sort of be looking at this. IRB will be looking at this as well when going through and determining, okay, well, is there a sort of unnecessary bias that could be skewing your results to showing one result or another? The thing I want to talk about here in terms of the actual articles, once you're reading them in the publications, is publication bias, right? Looking at author bias, things like that. So for example, with publications, if you did this big, huge study, you got thousands of dollars in grant money and you found absolutely nothing, you may be less likely to want to publish that. No one likes to publish failures. No one likes to publish negative results. And so you may find that when you're looking through the articles, you're only finding kind of the best of the best in terms of stuff that actually showed something. Now, does that mean that's the entire truth? Well, no, because there's maybe lots of data to refute what you're finding in these journals, but they never got published, right? That's something to consider, right? So take everything with a bit of a grain of salt. Have not a cynical eye, but just kind of be skeptical, right? A wise man once told me, to only believe nothing that you hear and only half of what you see, right? So always have a bit of a detective's eye when looking at this sort of stuff. And then also look at the author bias, right? So check out the financial disclosures. If you read here in this article, they actually had no reports of conflict of interest. But you may find that some of these authors are being paid by drug companies that may influence their results. They may have honoraria that they get for speaking for some of these companies and things like that. So it could be a financial aspect. They should disclose this sort of stuff. And again, if they don't say anything, you may not know, but that is part of the process. And again, you say that when you submit these sorts of things that yes, you're being honest and you're reporting any conflicts that could be skewing your information one way or the other. The other thing to consider as well is who funded the study. I found a really good example of this. Not too long ago, I was looking on there's a science subreddit. If you guys are familiar with the website Reddit, and they had this thing saying that, if you eat 100 grams of blueberries, that'll cut down your risk for death or something, right? And so when you actually got into the article itself, it was like, okay, well, they were looking at like morbidly obese people who were eating 100 grams of blueberries versus not. And of course, just the introduction of any kind of fibrous fruit or vegetable would probably help out with coronary risk. But beyond that, guess who published the study? Well, it was the Blueberry Farmers Association or something like that. So they probably have a little bit of financial interest in making sure that they show positive results associated with blueberries. more people go out and buy blueberries, they think they're doing themselves some good in terms of health. So you'll find stuff like that gets reported out in the news all the time. You'll find on the Today Show or CBS Morning Show, something like that. It'll say, hey, we found that chocolate can cut your chance of death by half, and it's like, well, okay, well, who says that? Was it Nestle's that said that? Maybe something you want to look into. So again, who funded the study? Where's the money coming from? It's always something to take into consideration. And saying, okay, well, does this actual article have any sort of bias that needs to be accounted for? Anyway, that is it for the video this week. If you have any questions, let me know. And again, work on those literature reviews. I'm looking forward to taking a look at those this Friday. Thanks so much.